Hello, ladies. How are you? Welcome, Debbie, and welcome, Isabella.
Hi.
Hi.
So great to have you on. I am super excited because obviously, a couple of reasons. One is because AACDS are foundation partners of ABIC, and it's always a pleasure to work with you guys and talk about what's new and what's happening in the industry, but also because I personally have hired AACDS graduates for years and years, ever since you guys started. So I had 14 medical aesthetic clinics, and every time I saw a graduate from AACDS, I was like, I jumped on it. I interviewed them. I love them.
Yeah.
They're so amazing. The education that is provided there is really second to none, and it's such a privilege working with you, with AACDS and with you both as well. But I would love to start this session with a few things. So we're going to be talking about trends, innovations, it's in the lead up to Beauty Expo. So we've got loads to talk about. AACDS is there as well. So if you're hanging around Beauty Expo, walking around, go and find them for sure. But I would love to know from you both, what do you actually do with AACDS? What's your background? Tell us a bit about yourselves. Debbie, do you want to go first?
Yeah. So I have been a nurse for a long, long time. And I was a theatre nurse and I had a back injury and the workers comped me out into GP land. And at that time, there was a lot of money to be made in aesthetics. So all the doctors were getting into it. And some of them were really bad. And I was like, I need to know how to do this better. So
Mm.
I enrolled and did the postgrad at AACDS and fell in love with the place. That's always been my dream place to work. And I've been injecting full time for 11 years now. And now I do the training and assessing. And I've just built the skill set as well. There's going to be a skill set coming out for nurses, and I've just built that.
Oh, love that. Can't wait to find out more about the skill set as well. That's probably a different conversation. But loads of experience, 11 years, just really privileged to have you here as well. And Isabella, tell me a little bit about yourself. You're going through a journey right now.
Yes, I'm probably different to Debbie, definitely not as many years experience, but I am on the journey. I've come a long way in a short period of time. But similar background to Debbie, I'm actually a theatre nurse as well. So I did anesthetic nursing, which I loved and really enjoyed. And then I started my postgrad study with AACDS. So I was a former student myself. And then once I graduated, I started working with a plastic surgeon quite closely. I was his anesthetic nurse, and then I was his injectable nursing clinic, and he taught me a lot of more skills. And then within then I've grown and I've just moved to a clinic the past 18 months in Armidale in Melbourne doing a subcontracting role. So I'm kind of working for myself. And then AACDS reached out wanting me to come back on board, potentially treating their private clients and then moving towards becoming a trainer. So we did a little bit of restructure with AACDS just to accommodate with 2 extra students with our intensive practicals. So I've become now a clinical trainer there, facilitating those once a month with our doctor and then our assessor, Christy, who's lovely. She actually taught me. So it's a bit of a whirlwind coming back as a trainer when you've been taught by your colleague. And I'm just currently studying my TAE so that I can be an assessor and help with the paperwork load. So I'm in the middle of that. And then I also do train for a company called Dermal Institute in Melbourne. So I teach students on a day basis, so like a Saturday or a Sunday, particular skills. So similar to what we'll probably be offering in the skill set course with AACDS, where patients can upskill and learn a particular certain thing, whereas your AACDS obviously is more in depth and it's quite broad of what you learn, and it's a really good foundation for anybody interested in cosmetic nursing, and it teaches you very safe practices.
Oh, it's an amazing course. I feel like it's one of a kind, really,
Mm.
in the industry. And I believe that they also have a cosmetic doctor course as well.
Yeah, that's coming out. Yeah.
Coming
Yep.
out. It's so exciting because we get to level up the industry and really provide the education that has been lacking. It's been a gap in our industry, and they are really pioneers, Kylie and her team, and
Mm.
yourselves. It's quite inspiring to watch, actually.
Mm.
And so you would have access to so much knowledge and education. I mean, collectively speaking, you get access to, all the suppliers, all the cool brands. You have such a diverse range of devices. And you also tell me about some trends. I mean, everyone talks about, what's hot, what's not, but really, I'd love to know anything that was hot that probably isn't so hot right now. What are the trends on the way out, do you both feel?
I think salmon sperm.
Really?
Yeah, yeah. The read-around that came out, that was all wonderful and lovely, and it hasn't lived up to its hype, and that's going out. I think skin is in a big way, but for me, I would say read-around is on its way out.
Ooh, that's a big call. What about you, Isabella? Do you think that? I'm a Ridge fan. I have it all the time, and hopefully I'm glowing.
Yeah. I actually think that what clients thinks are going out versus what we think is going out is a little bit different on this one. So I've had a lot of clients come to me saying that they feel like volumizing treatments, I can't be explicit of what I'm saying because of regulations, but volume replacement treatments, people are steering away from because they don't want that fake look and things. But sitting down with a client and providing a holistic assessment of their features and their face, volumizing treatments can be used in a way to enhance their features. So then you educate them of what it actually does look like when it's done properly. So like for myself, I use myself as a prime example for my clients. I tell them what I've had done, X, Y, and Z. And they said, oh, but that looks natural. That looks great. And I said, yes, it can be done when it's done appropriately and it suits you. So I think clients are coming in saying that they don't want to put their money towards those treatments. But if you educate them that it is appropriate for them, I feel like then they learn, okay, it's actually not going away. It's not a not hot topic at the moment.
Yeah, the overfilled look has scared a lot of people. I mean, they come in and they go, but I don't want to look like a fish. I don't want to look like a duck. And it's like it's not like that anymore.
Yeah.
I love that. I mean, I've been waiting for that to go away from the very beginning.
Oh, God,
I was like, oh gosh, please go away. Don't be a trend.
It's given our industry. It's given our industry such a bad name when they're all over the TV and they're all over the media, and they just think that if they come to see us, that's what they're going to look like. So a lot of it is educating them.
But do you think it's strange that it was ever in fashion? Like, I look at trends sometimes, even with clothes and even with, what's in fashion. And sometimes I'm like, how? How were we just hypnotized like a cultural hypnosis?
I think it's the evolution of the industry. Like it's something that's been quite new, right? Think about anti-wrinkle Juvederm created their product 20 years ago. It's not been around for a long time. So skill set of people, it's taken over 15 years for us to evolutionize and get better at it. So the overfilled look from back then is probably from not much patient knowledge, client knowledge, clinician knowledge, also products. Like products have come a long way since then. And they're a lot more adaptable now to our tissue. So I think that probably has a play into it.
I also think that people were walking in saying, in my clinics, they were saying, I want those lips. And we're like, we don't do those lips. Well, we just never did, we always.
And we were always told that it lasts 6 months. And so 6 months on the dot, people would be back saying it's all gone, I need more. And then people would put more in. And we know now it doesn't. It lasts a lot longer.
There's been studies and I think there's been ultrasound evidence of, 6-7 years and it's still in the underlying tissue or has changed the underlying tissue and remnants are still in there. What do you think of that particular finding? Do you believe it? Is it a truth or is it?
I don't think it's a bad thing because you're paying for something to last. So if you're finding out that it's lasting longer, as long as it's in the right plane, I think it's a good thing.
Cool. And so in terms of what's new then, skin is in, we know that, but what does that mean in terms of trends? What innovations, I suppose, are in now in terms of the skin, not the devices, products, things like that?
I think that there's a lot of products being made and introduced that are designed to enhance your cell function. So they're designed to stimulate your fibroblasts. They're designed to stimulate your own collagen and elastin. So a big hot word at the moment is bioregenerator. And I've recently got a product in the clinic from past, I think I got in about a month ago. It's been in New Zealand for 5 years. And it's just becoming hot here, and I'm getting great results. And it's all about your skin health. It's all about supporting your skin during perimenopause, menopausal women, supporting elastin production, collagen, helping with tone, texture. But it's not it doesn't change the way you look, as in it doesn't create any volume or anything like that. And it doesn't paralyze the muscle. So it's just a different injectable technique that we could do and offer clients that are suited to that.
Is it like a skin booster, would you say? HA
Yes.
with a mixture of
Yeah, so
aminos and other things?
it's like a high and a low molecular weight hyaluronic acid, and it's got 8 amino acids in there. So they're essential aminos for our skin cell function and to enhance cell signaling as well. So every skin booster is a bit of an umbrella term. Every company's kind of got their version of a skin booster, but it's something that enhances your cell function.
Wonderful. You can't name the name, is it an S4?
Yeah.
There's some really nice ones out there at the minute. There is some nice ones.
Perfect. And in terms of devices, and are they in or are they out? I mean, I know. Oh, really? I have so many conversations about, heat's out. No more heat. We don't want to touch our skin. Tell me.
No, laser is in. It's everywhere. It's everywhere. Yeah, my favorite. CO2 laser all day long.
CO2. Ooh, intense. Tell me why.
Oh, it's beautiful. And you don't have to go fully ablative. You can go fractional ablative, and it just gives such a nice glow afterwards. IPL's always going to be in, and then with all the restrictions and everything with advertising, a lot of clinics are expanding now to bring in devices because they can advertise them.
Not sure for how long. I've been having discussions with TGA. There's some regulation of brewing.
There's some crackdowns coming.
Yeah, so just be wary when it comes to that, I suppose. We're definitely advocating for stricter regulation in that sense, in terms of devices where we are particularly looking for hopefully filtering out non-TGA listed devices completely from Australia. I would love to see analogous devices of Cosmetic having to have TGA approval for or TGA listing for what they claim. And I reckon that's great. And I also would love the qualifications to match the regulation, meaning if you don't have the right qualifications to be able to use a laser or IPL, I think that you shouldn't be able to use it without the proper training, whatever that looks like in the end, is to be decided. But definitely nobody from from a different industry should be able to pick up a laser if they don't know what they're doing. So that's what we're advocating for. Do you guys believe the same thing?
Oh, indeed.
Yeah,
and
absolutely.
Demi is now partnered as well with Bravura, who did get on, and Alicia. Beautiful. That was a really, really good course. So we do have a lot of laser and IPL courses. So yeah, there'll be qualifications for that too.
And if you don't know what Bravura is, it's an online as well learning platform that is so extensive with regards to the breadth of learning that you have on there with modalities, lasers, various skin treatments as well. So it's
they're approved by the radiation councils as well, which is good.
Absolutely. It's definitely added another layer into the offer of Demi Group. And if you don't know why the name Demi Group has dropped, it's because Demi Group has purchased AACDS. So now Demi Group, which is the largest education provider in our industry, they also do the diploma of beauty therapy. And AACDS is now in that, and now Bravura is in that. So it encompasses so much, and you just have so much choice when you're
so excited.
when you're dealing with this organization, every layer at every level as well. And I'm not sure if you know, but AACDS has been invited to the ABIC breakfast that's partnering with SAXA. So SAXA, Skills and Creative Australia, and ABIC are hosting a breakfast in the morning at Expo. Expo's hosting us. They are so incredibly generous. They're giving us a big, beautiful conference room to do a consultation workshop for the beauty qualifications on Saturday morning at 7 a.m. And so there are a few tickets left if somebody wants to participate in that consultation. I think there are a couple of tickets left, and then it's completely sold out. Or not, it's free. It's not, you don't actually have to pay, but the tickets will be gone probably in the next day or two. So if anybody wants to check it out, you can have a look at the link in our bio, and I think there are a couple of tickets. So in terms of innovations, devices, lasers, what's out?
I don't know if it's out, but it's something I would like to be out, the plasma pen.
Say that. I was like, she's going to say plasma pen. 100%. But if it's done properly, have you seen the results though?
Yeah, but when I had my clinic, I bought a proper jet plasma, and it was $16,000.
Yes.
So the ones that are on the market now are not true plasma, and it's scary. And yes, some people do it well. Some people get really great results. A lot of people don't.
Pitted scarring, like I've seen a few. We've seen a couple of them that needed quite a bit of extensive treatment afterwards that they did resolve eventually. But the tightening that I've seen, you know, the face lifting, the noses, the reformation of noses, I don't see anything out there that has those results in the right hands with the right.
And I think that's the thing, isn't it? It's in the right hands. But when they're buying these ones off wherever they're buying them, they don't know what they're doing, and so they're not getting the results.
Absolutely. Isabella, what do you think of Alibaba equipment? Should we be able to buy equipment?
Absolutely not. If I can't advertise my treatment services, we should not be able to buy equipment from Alibaba.
No, very true. Very true.
How do you think we stop this? What's your ideas? If you know you're giving advice to the industry or us as an advocacy group, how do you think we should tackle that problem? It's a hard question.
Just educate, just educate. You're buying your treatment for your client. If you don't spend money on the device or the treatment tool, those results you're going to give a client are going to be subpar. They're not going to be the best result. And then that's when your price point comes in. So if you're going to be charging a client a significant price for a treatment, you want as a practitioner to have all those controllables of saying, yes, I can give this client the best treatment outcome, and part of that is using the right equipment. So for example, PRP, PRF, the centrifuge machine and the equipment you use to extract the blood is all controllables you can maintain. And when you've got a good centrifuge machine, you can guarantee results. The one thing I don't really like about PRP, PRF is I can't control your blood. So if you go and have 3 wines the night before, and then I do PRP or PRF, and the results not as good as the first session, it's like I've done everything the same. I've used the same machine. I've used the same technique of drawing blood, the same amount, but you having a few wines impacted our results. So for me, I'd say what's going out is those things that we can't control. So PRP, PRF, I do see going out. It's also quite fickle for us to do as a practitioner. And it's also drawing blood as well. So that I wouldn't want to do it all the time. If you don't need blood out of your body, let's let it all just circulate and stay in there.
That's controversial. I love that.
I also think that downtime is going out. So my clients so even though lasers are great, but we have a erbium laser associated with our RF needling machine here. And erbium is an ablative laser, but it's a non-ablative laser, and it targets your deep dermis to stimulate your collagen. And that's been great. So minimal downtime with our RF machine. And I've had a lot of clients coming in not wanting your traditional swelling and downtime with treatments.
Oh, wow.
I think downtime though has always been a bit hard to sell. Yeah, so now it's the ones where you have to say to people that yeah, we can get a good result without the downtime, but if you can do a week's downtime, you get better results. So it's again, like you say, it's educating. And
Yeah.
having that choice that you can say, well, we've got this to do this, we've got this to do this, we've got this to do this.
And what about PRP versus PRF? I like them both. I know you're saying they're out. I do. I can see great results if done. Do your patient checks, make sure that that person's got a healthy lifestyle, doing the right thing. It's hard to control immune responses as well. Like you might not know that that person has a virus or has a weakened immune system at that particular month. But controlled well, I've seen some really good hair results.
I love PRP.
Yeah.
I love PRP. I've had PRF myself, and the swelling was a lot worse than PRP.
Really?
Yeah, so I wouldn't go for PRF again. Not saying there's anything wrong with it. It's just for me, there was a lot of swelling that I don't get with PRP.
And so, what's the benefits of PRP versus PRF?
I don't think there is.
No?
I think that was another catchphrase.
I find PRF is good for tear troughs.
Okay.
It's great for tear troughs. I wouldn't even bother with PRP underneath the eyes because it's more concentrated in growth factors. And you're using a cannula.
PRP.
And
we had
PRP. Yeah.
PRP.
Yeah. We had a lady one time that had PRF under her eyes, and she'd had previous dermal filler, and we ended up having to dissolve all her filler because it all reacted and it all swelled up really badly, and so we dissolved her filler under her eyes. So that was interesting.
Did the swelling last for a while? Like, was it a month?
On mine, I had a good week. It was really, and mine was in my tear troughs, and they just swelled up. Yeah. So again, everybody's different. Everybody's blood's different. Everybody's lifestyle's different.
And it's an immune response in your skin. So think about what it's doing to the skin. So swelling is going to happen.
Yeah, right. Okay, well, I can just even with this session, so much to learn, so much to unpack, so much there. And as you can see, when you're talking about the industry, this is just a tiny little bit of what you can learn if you go and put the time in for your education. And our industry is so dynamic, it's changing so fast. If you don't have those foundations, if you're practicing out there, you're a cosmetic nurse or you're performing dermal treatments, that you might be a beauty therapist, take the time. My advice is take the time, go and learn. It's a short period of time in your career and you have these incredible foundations you will not be able to get from a 2-3 day course. It's just impossible. The breadth of knowledge that you get, and this company has just exploded. Demi Group, AACDS, and Bravura together is a force to be reckoned with. Anything you guys want to leave us with before we go?
Can I just say, I was talking to our ops manager the other day. I've been training there now since 24, and I've also done some training for another company, and all the nurses that have gone through AACDS and have passed their prac have all got jobs. And I know on the other course they haven't, because they keep ringing me and asking me, do I know of anybody hiring? I've had students get employed while they're still on prac. It's if you want a good grounding and a really good knowledge base, it's a no-brainer.
Absolutely. And can I just add to that? We were looking for AACDS graduates the whole time. There was a shortage of them because we could never get enough staff. I mean, you could think 14 clinics and over 100 staff I had. And I'm always on the lookout for resumes with AACDS on there. Honestly, the candidates were second to none.
Yeah, it's the highest qualification in Australia for aesthetics.
Beautiful. I'm so glad they spent the time to get it right as well. Thank you so much for joining me on this rapid fire trends and what's hot and what's not in the lead up to Expo. I'm going to see you both there. Are you going to be there?
No, I'm working. Got students.
Well, you can all come and say hello to AACDS. I'm pretty sure they have a stand there, and I'll be there as well. So thank you so much for watching, everyone. Thanks, Deb and Isabella.
Thank you.
Thank you.
Thank you.
Bye, everyone.
Thanks. Bye.
Bye.